Welcome, and thank you for joining us for another discussion in the I Am New Orleans Conversation Series. I'm Meshawn Tarver. I'm a doula, lactation consultant in training, and since 2019, I have served as the Senior Program Manager for Maternal and Child Health at the Institute for Women and Ethnic Studies. I love to learn and converse about maternal and child health, which is why I'm here today. It is my honor to serve as your moderator. I am a mother of 3 intelligent and beautiful girls and a very funny and handsome bonus son. I am passionate about and dedicated to changing the landscape of the health of women and children in the city of New Orleans through research, community outreach and advocacy, provider engagement, systemic change, and most importantly, personal growth and development, because we must start with self first. Today, we're going to talk about breastfeeding. So as you might know, August is World Breastfeeding Month, and this week is Black Breastfeeding Week. We want to engage you this afternoon as we discuss the importance of breastfeeding, maternal health in communities of color, and building an equitable future for mothers and children to thrive. For those unfamiliar with I Am New Orleans, it is a conversation series that is being led by the community to inspire conversation and action around critical issues of racial equity that impact our children. Before we get started, I have a few housekeeping items. So this conversation offers live Spanish and Vietnamese translations and closed captioning, which you can access at the bottom of your screen. You can use your chat box to add to the conversation and ask our panelists questions. Throughout the conversation, you'll see some polling questions pop up. This is another opportunity for you to join in. Today's conversation is being recorded, so when we can share that and additional resources with you afterward. And most importantly, remember to join the conversation socially using hashtag I Am New Orleans. Again, that's hashtag I Am New Orleans. Our goal today is to stimulate conversation and action around critical issues of racial equity. So please go on your social media accounts and share your stories. Now I'm going to introduce our panelists and then show you a short inspirational video the W.K. Kellogg Foundation created about our maternal health work in New Orleans. We're going to start first with Taeshaun Walters.
Hello, my name is Taeshaun Walters, affectionately known as Tay. I am a certified lactation counselor and parent educator for Training Grounds, also known as the We Play Center. I have a true passion for maternal child health, and I'm also an aspiring IBCLC, and I have just completed my doula training, and so I am so excited to get to work and put those boots on the ground, and I'm so excited to be here. Thank you for having me.
Thank you, Tay. Let's pass it to Victoria.
Hello, I'm Victoria Williams, a licensed master social worker, certified breastfeeding specialist, sister midwife production doula, community activist in New Orleans, currently working with BirthMark Doula Collective and Sister Midwife Productions as a trainer, and glad to be here.
Welcome again, Victoria. How about Chantell?
Hi, everyone. My name is Chantell Reed. I am the Deputy Director for the New Orleans Health Department. I'm currently overseeing both the WIC and Healthy Start programs within the city and overseeing all maternal child health initiatives. I have a strong background in healthcare management and administration, so doing a whole bunch of different things. I was thrust into this role of maternal child health, and now I'm finding a passion. I recently became a doula, and I'm really excited to be a part of the conversations and a part of this movement and changing a generation. So thank you all for having me here today.
We're happy you drank the MCH Kool-Aid, Chantell. So let's see, our final panelist is Dr. Morse.
Hey y'all, I'm Dr. Tara Morse. I'm a board certified OB-GYN. I practiced in private practice for 6 years in the New Orleans community out of the Bywater and the Mid-City area, and recently transitioned to an OB-GYN hospitalist role. at the hospital, and also became actively involved in our maternal child health department as far as birth equity and healthcare outcomes for all women in the city of New Orleans. And I'm also a mother of 2 little babies, both breastfed, one still breastfeeding up to 2. So I have a lot of experience in this whole realm. I'm happy to be here.
Wow, we have a beautiful panelist here today, and we're going to touch on all of those levels, how we can make change in our community. So we're going to start off with discussing how to establish a personal relationship with breastfeeding. Now, there are many benefits to breastfeeding. We know that it builds the baby's immune system. It's that first booster shot. We know that it lowered the rates of infant death, which is extremely important in our state, as our Black babies are dying 4 times at a higher rate. And we have so many premature babies in our state. So it's helping to save those lives. It reduces allergies, type 1 diabetes, eczema, and just so much more for the baby. But we also know that there are benefits for mom, like it decreases postpartum bleeding, postpartum depression. It helps with that weight loss for those of us who are trying to get that good figure back. And then there are long-term benefits like breast and reducing the risk of breast and ovarian cancer. And for the family, there's a lot of cost savings. Breast milk costs $0 compared to formula. So panelists, if there are so many benefits of breastfeeding, why are there stigmas? Can you tell me what are the current stigmas surrounding breastfeeding in our community? Chantell, you want to start us off?
Sure. I mean, I will. I think, and I saw this, I will have to admit, on one of the junkets that were running on TV this week. And I can identify with this story. So one of the hurdles is generationally, we have not been women that have breastfed. And I mean, I can speak specifically to my own situation with my grandmother. My grandmother said, oh, you're not a wet nurse. So if I'm not a wet nurse, then I shouldn't be breastfeeding children. I think that it is a cultural thing that we have to overcome. I think that it is a perception thing where, oh no, you're able to sustain and take care of your family, with not really understanding truly all of the benefits and all of the things that could potentially be, um, beneficial, I'll say, for yourself and for your baby. We have a lot, but I'm also very proud to say that we have come so far. Those are the things that we have to look at, because in your homes, with your families, at parties and at different places, those people who you surround yourself with, those are the people who kind of impact that. And we've seen that. So I know in this work that we do right now, it's going to be an obstacle that we have to overcome, right? We have to overcome this whole idea that, that's not what we do, or we don't have to do that anymore. We're making money now, so you don't have to rely on your body, not understanding truly all of the beneficial factors. So those things I think probably resonated. My grandmother's pretty strong. And when you have those strong women, especially strong Black women in your family, that tells you those types of things, to me, that's a major, major hurdle that you have to overcome.
So Chantell, let's pivot it. You brought up a great point, and the video that we want to share really highlights this. So let's watch this video. So one of the things that's key, living in a city that's mommy and baby friendly, that we have a body or a community of women that feel empowered about their bodies, and that they are birthing in a space, in a community that actually welcomes their voice, that respects them regardless of their race. I would love to see policies and systems in place that embrace that as well, so that a woman doesn't have to fight so much for her rights in this community, that the community actually gets it.
Let's talk about the benefits to mom and baby.
We can go all day. we can go all day. I mean, that initial skin to skin helps moms bond. They have a appropriate parental attachment, the higher IQ scores, the less asthma, obesity, eczema. We can go all day.
And for mom, the long-term benefits of breastfeeding, like reduced risk of breast cancer. And then for families, like the cost of breast milk is free. And so breast milk actually helps the premature infant to actually be able to survive. In addition to the maternal mortality rates are higher, the infant mortality rates are higher in Louisiana as well, and especially for Black women. So breastfeeding is a protective factor for those babies that are really struggling in the hospital.
And you start to see an inverse relationship. Areas where they have high breastfeeding rates have low maternal infant morbidity. So if we can narrow that gap, we can even that out.
Maternal mortality in the U.S. is, the rate is one of the highest in all developing countries. And sadly, it's actually on the rise, despite decreases elsewhere. And this is really counterintuitive to advances in medical care, better access to prenatal care.
What we know about maternal health disparities that are happening right now is that women of color are dying at a rate that is 4 times greater than white women in this country. And that's the cause of negligence. It's the cause of implicit bias. I think what we're trying to do is change and shift the perspective of when that client walks into the hospital, what is the doctor seeing? Are they seeing a human who's scared and who needs their help, or are they seeing a demographic?
One big issue that I also, and we talk about this all the time, is that in some cultures, especially African American, you only go to doctor when you're pregnant. Like, you don't have a primary care doctor, you don't have an ENT, you don't have this and you don't have that. In Louisiana itself, we range between 48 and 49 in breastfeeding. Currently, the minority women, which is like African American, Asian, Spanish women, they are breastfeeding 3 times less than the majority. So their initiation rates are low and their continuation rates, like at 6 months and 1 year, are lower.
And the care that Black women get in New Orleans and elsewhere is likely very different. We all hold implicit biases, and there are movements locally and nationally to start to address this.
And so that's why NOLA Baby Cafe was so imperative for our community, is because once the women left the hospitals, that was it.
This is something that we need to be doing. We need to be like holistically supportive of our women. We're not just answering to their desires, but we're also answering to their needs and to the needs of our children. So we should be coaching other dads like how to be supportive of their wife to breastfeed, because there's always seems to be some type of apprehension.
When a woman is breastfeeding, she needs the support of her husband. She needs the support of her family, her mom or the grandmother in the family. She needs the support of her employers in order to get through it.
Like, we need to see people who look like us and talk like us and who understand what's going on. I would like to create a paradigm shift in the thought process of how we feed our babies. Some moms are scared to breastfeed their babies. I want moms to feel like that they're the only person that can do that, and that's the best choice for their babies.
That's a beautiful video. I always enjoy seeing it. So let's talk to one of our other superstars on the video. Victoria, if you can talk about adding more about the stigmas that you see as a CBS, a certified breastfeeding specialist.
I mean, as a community advocate, I've seen so many different, concepts and ideas around breastfeeding. One being that it hurts, and this strong family dynamic of this the matriarch of those people in our family who say really negative things about breastfeeding. Chantell touched on one. You ain't no wet nurse, or you got money and don't you work a good job? You don't have to breastfeed. I've even heard concepts around you're gay if you letting your baby breastfeed, and it's like, what? I'm doing the best for my child, and you're gonna like condemn me for doing something that I feel is the best thing for my child. So really breaking those stigmas and breaking those barriers is one of the ways that we can get more parents to breastfeed, or just have the knowledge around breastfeeding. That was my husband in the video, and he spoke very highly around not just educating the parent, but sometimes those partners have an ideal around, my boy, he not going to be sucking on no, I've heard the extreme. So yeah, the stigmas are still there, unfortunately. In 2021, we're still working to break those stigmas.
Yeah, that's very unfortunate. Dr. Morse, as a physician and from your personal, because you are a breastfeeding mom, what kind of stigmas have you heard about?
I mean, I think there's a lot of both what Chantell said, there's a lot of family stigma. I had it, my own mom didn't breastfeed, my grandmother didn't breastfeed, my husband's mom didn't breastfeed. I heard it all the time. And I also think, to echo Victoria too, like, unfortunately, like, breasts are sexualized. They're sexualized to be this thing. We see it in the media, we see it on magazines, like, they're not meant to be like there to feed your child, which is so sad. I mean, I think of myself as a mother at a restaurant with a screaming infant, and I do what's natural. I breastfeed my child, and the tables around me, the stigma of them staring at me like, how could I just, breastfeed my child in public in front of them and in their meal? It's really sad that we still live in an era where things have to be so, like, where breastfeeding has to be so like sexualized. Like, why does me giving my child my breast have to be something sexual? Why is that the first thing that people have to think of? And unfortunately, I think what Victoria said is, like, I've heard, significant others being like, your baby doesn't need X, Y, and Z. We'll leave the explicits off the Zoom, but it's sad, especially when you hear it from the people who are supposed to be supporting the patients. And then so it's hard as a healthcare provider, and it's hard, I think, as a community support group, as we all are, to break those barriers, because you don't get to go home with that client every day. They're going home to their family, and the family is the ones that are going to be the ones that come in and say all those things.
Yeah, excellent point. And if we really think about it, as a nation, we hit rock bottom with our breastfeeding rates in the 70s. So we've been working since the 70s to build those up. And so we're dealing with generations. That was 60 years ago. So we're still dealing, wait, my math is all 50 years ago. We're still dealing with generations of breaking that cycle, regardless, white,
Yep.
Black, Hispanic. We all have a hurdle in our families to go through. So let's shift
Yep.
it a little bit. I want to shift this next question to Tay. How can we promote breastfeeding so that more people are aware of the benefits for babies and mothers?
Yes, totally. I would say social media is a big aspect that we can use to our advantage. So many moms are on Facebook and Instagram and Twitter, especially our young moms, our teen moms. And so we definitely want to make sure that we make this accessible via social media, showing those pictures, those very vulnerable pictures of moms latching baby without cover up, so that they can see that this is normal. This is what it looks like. Everyone around the world is feeding their baby like this. So really just making it acceptable. Even how I Am New Orleans put the awesome billboard up in New Orleans. It was so exciting to see that. So putting that more out. I've even said I personally want to do my own breastfeeding campaign. We have in New Orleans, drinking is really big. We have Crown Royal plastered all over these buses. Let's put mamas on these buses with these babies breastfeeding, so that they can see this all over the city, riding around. How beautiful that would be. So just making it more normal to see visually. We're a visual generation, so we want to see things. So having those photographs of people breastfeeding, looking like them, this is normal, this is how this looks. Just really making it acceptable in that visual perspective, I think would be so amazing.
Yeah, and I think with that images, you're desexualizing, like Dr. Morse talked about, is so sexualized. So having those images, we desexualize breastfeeding.
Totally.
Victoria?
I think another campaign is to be able for people to see it like in real life, real time. So that looks like people in clinics, in doctor's office, in the WIC clinics, actively breastfeeding and actively like being that person where someone else can say, hey, what is that like? You know, or somebody breastfeeding a toddler, you know, in public. What does that look like? So baby cafes are super important because people are able to see other, you know, women breastfeed openly.
Yeah. Thank you, Victorian family. But Dr. Morse, when we talk about promoting breastfeeding more in the community, what are some ways, because I know that you actively promote a breastfeeding in your practice, how do you promote well, tell us that. How do you promote breastfeeding in your practice?
I'm a stickler about it. When I was in private practice, I would talk to a patient about it almost at every single visit. I'd ask them what their form of feeding is. I would ask them what their like breakdown was. Why would we not even try breastfeeding? And even now as a hospitalist, every woman I see who comes into triage, it's my question before they walk out the door: what is our plan to feed that baby? I am a huge supporter of a baby cafe. I used to joke with patients until I had my first child. I could have told you about breastfeeding from what I read in a book. Until you actively breastfeed, you really don't know. I remember sitting across from patients that I had delivered in a baby cafe, breastfeeding my own child. And so I wear baby cafe t-shirts around with my scrubs all the time. And I just get that conversation started and get women to start liking the Instagram and the Facebook, exactly what Tay said. Like we're in such a social media world. To get people to start liking those things, they're going to get that feed to pop up, and hopefully with just that continued stimulation, our breastfeeding rates can get higher.
So on I think all of us have said that, well, because I know you all, I know that we talked about that our mothers didn't breastfeed us. And I just want to end on that. If Victoria, if you can just touch on, if you have a moment, about the importance of us breastfeeding so that our family and friends can see.
No, that is so important. It's funny that you say that because my niece just recently had a baby. I am like a great aunt. It's so weird. But my niece just had a baby, and my sister called me. You know, she was having some difficulties, and she's like, I didn't breastfeed. I'm learning from you, you know, so tell me everything. How can I support her? Because they live out of state. And so I just kind of ran it down. But the great thing about being a first generation breastfeeder in your family is that people are now leaning to you for information, which means that as a first generation breastfeeder, it is imperative that you find some type of lactation counseling class or be a peer counselor so that you can help others, like lend to your experience, understand how important it is to continue to feed the knowledge of our generation. Like I think about that. My mom didn't breastfeed and my sister didn't. I mean, she breastfed a little bit and she's 20 years older than me. So think about our generation, like when I become a grandmother and how my kids would be like, yeah, my mom breastfed me till I was almost 3, you know, and my sister, my daughter who is 16, I didn't last that long. I was a young mom. So that's also my motivation in this, to have other people who look like you, who are in your same age bracket, like have that information. Even if they say, girl, it's good, just do it. You know, they may not tell you everything, but we can start with that is good for your baby. So try it.
So before we go to our poll, I want to pose this question to Chantell. So how can we as a community encourage the development of infrastructure for breastfeeding to make it more accessible and feasible for mothers to breastfeed?
Well, one, I'm gonna start with a network, right? So having this network of all of you all here, I think we are on calls, at least once a week, once a month. I mean, in some form of fashion, like having a network, right? So that we're informed, from providers' perspectives, we're informed from multiple different aspects, right? That's the first thing, because I'll speak for myself. I needed to be educated. I work in hospital and healthcare administration and done a whole number of different things, specifically healthcare administration, because I've done community stuff, not necessarily hospital, but I had to educate myself. So starting there, right, making sure that you have the real and true facts. That's the first place. The second part of that is people in positions like mine in the city, as we have these networks that we've created with opportunities. So whether it's private, public, federal, what have you, we have to be able to direct the resources in order to be able to support moms, in order, one, to dispel the messaging that has been put out there, or that we know intrinsically, like what we've been taught, or inherently what we've been taught. But then also from the other perspective of making sure that you guys as providers, and I'm saying you guys, I'm now a doula, right? Us having the resources to be able to do these things. So how can I bring Nola Baby Cafe, right, to the masses so that Victoria can say, like, I'm not worried, my baby's right here, I'm about to do it right here, no problem. Or Tara saying, you know what, we're on vacation, excuse me 1 second, I need to do it right here, and undo those things if I don't have the opportunities for you or the platforms for you to be able to do that. So starting with networking, making sure that the infrastructure is strong with partners, excuse me, starting with those partners, but then making sure that you have resources and funding and connection to all of those things out there in order to be able to do that. That's not that, you know, that's not the organic response, but I look at it from as an impactor in what I do as my role in the health department. I think that that's a necessary place for me to be in order to be able to support moving these efforts and initiatives forward. So making sure that the messaging is good, making sure that you have support, bringing you into some of the institutional places that we have, like Healthy Start and WIC, and saying, you know what, well, we're going to do this right here in this place. And recognizing it. So one big thing was, and I said this kind of before, was, oh, well, dads weren't welcome in the WIC clinic when I first got to the health department. That was the perception. That was a perception. That was never ever a policy, but that was the perception. And I was like, well, why? He got to do the work too. Like, if you know me, and when I had my children with my husband, I was like, oh no, you have to help with this work. So with Victoria's husband being there saying, look, I gotta help and I gotta support, I know what that's like. I know what it's like sitting with my breasts saying there's not enough milk coming out, there's not enough things coming out, and these things are happening. You need that support from the male to be there. So it's looking at whether it's policy or whether it's perception, because I think that's the critical key, right? Dispelling those things from a policy-based place. So you know what? I went into the WIC clinics. I went into Healthy Start and said, all right, so all that stuff that y'all thought that y'all learned and that was okay to do, well, we gotta stop that from happening. So that would be my perspective, like I said, as an impactor from a city level on how we impact those things. If I don't empower you to be able to do the things that you need, you can't go and teach the message that you have even deeper than what my limited knowledge is.
I love it. All right, audience, let's do our first poll. So you're gonna receive a cue in the chat feature, and it's gonna be a poll question. It's gonna pop up and it'll last about 30 seconds. So I need you to read it and answer the question. All right, probably have a few more seconds. Thank you. So let's see, our survey respondents said, the question is, how is breastfeeding perceived or received in your community? And 53% of you said that it's like hide and go seek, you have to be discreet. So, okay, we have some work to do. All right, let's move on. So just looking at that poll, this question is very pertinent. Many families aren't aware of the resources available for breastfeeding. What are some of the places they should start? How can we provide better access? All right, Tay, start us off.
Yes. So of course we have Baby Cafe, which is an awesome resource to moms here in the city of New Orleans. That mom-to-mom support is like no other. Right now during COVID, it's been easily accessible because it's over via Zoom, and moms can just click the link and hop on wherever they are, on their lunch break, if they're at home. And even in the hospital, there was one mom we had, she was like still in the hospital, and she had hopped on Zoom. That was totally cool. So definitely being able to have the accessibility as far as for moms to be able to get to these different community events or resources that they can have. Also, BirthMark Doula Collective, our New Orleans Breastfeeding Center, they do lactation support as well. Cafe Olay, the Leche League. There is a list I think will be also made available for our panelists and hosts and all the people who are attending to be able to see the list of all of the resources that you can have at hand in order to be able to get these awesome tips and bits about breastfeeding and how that really looks, and what that really looks like as far as after the first hour of birth, and just kind of really learning about what breastfeeding really is and how beneficial it can be to you and your family.
So Chantell, tell us about the city's resources that you have.
So of course, like I said, there's Healthy Start and there's WIC. When I first kind of got thrust into the role of overseeing Healthy Start, I looked at what we currently provided, and it was, I'll be honest, it was very marginal in the very, very beginning. It was very that basic stuff that we know, right? It is, give you a little diapers, get you access to WIC to get formula, and then move on. Where I come from and my experience and my background, I feel like there's a necessary need for a more holistic approach to taking care of mom and taking care of families. So I kind of readjusted some things in order for us to be able to take that approach and work our WIC and Healthy Start more in collaboration with each other so that we can have that education component while also being able to provide the service. So with that, we have been able to, and I see some of the people are here now, as I've come to these different meetings and been involved in a lot of the movements and things that have happened, BirthMark doulas have been incorporated. So we are making sure that moms that are in Healthy Start now have a doula. We are also incorporating, of course, NolaBreastfeeding Cafe. We have to teach breastfeeding. We have to teach it appropriately. We have to teach it accurately, right? So that people have the information that they need in order to be able to make the best decisions for them. I think that bringing in those different partners, and certainly there are some more people here. I see Kimberly is here. I think that's the next step that my team has looked at me and said, hey, listen, we need to bring this in because we need to be able to address preemie moms and we need to be able to address some of these other issues. But all of those resources and a lot of the community partners here have been woven into the fabric of who we are. So that way we can take a bi-directional approach where it's not just, it is, I'll say, and I'm going to say this for lack of a better word, but a institutionalized approach, right? Where we've traditionally said, come to WIC, get the formula and you go. No, we want to do, so much more. We want to be able to provide you with education so that we can show you that these things are here. Come to WIC, come to Healthy Start. There are so many different partners that are here, and I'm very, very truly excited about us being the foundation, right? The foundational place for you to come, the city being foundational, right? In order to be able to allow you to come to get access to all of the resources that you need. So yes, thanks, Kim Falls Light. And I need to have a separate conversation because as we go into this and we do case conferences and we do so much more, there's so many other partners that are brought in, but definitely BirthMark doulas and different doulas around the city, because those are not the only doulas that we work with. We have MPs, Labor and Love, who are also working with us, MIST from LSU HSC that are providing behavioral health services because it's an emotional thing. I will tell you that breastfeeding was an extremely emotional thing for me. Mothers need that support. And I'm thinking, Melanie, I just talked to Melanie, training grounds. So many different services all in one place. And I'm trying to make it one-stop shopping. So I'm saying that those are the people that were here, but I'm certain other organizations that I'm not connected with and not have the opportunity to connect with. But please bring it to the city, because we're going to use WIC and Healthy Start as conduit to bring in whatever you need to resources to you.
All right. Victoria, can you add, I know Tay mentioned BirthMark Doula Collective and Cafe Au Lait. I know that you all specifically have groups for the Spanish speaking individuals.
Yes, Cafe Au Lait and Cafe Con Leche are great starting points for our parents. As a doula, I always also ask my parents to, the birthing people, when they want to decide to breastfeed, I'm like, tell me what you know first. Because that way we can dispel some of the myths. Because if you go into these groups and you don't feel comfortable as a person, really expressing and talking about what you know, then we've done justice. Like, we want to know what you know so that we can help you dispel those myths. So if your first start is just Google, right? What is breastfeeding? Kelly Moms, there are some other, reputable sources that can just tell you what breastfeeding is to start off. And then you can jump into all these different other groups, because sometimes those groups can feel daunting. They can feel like, oh, I'm not experienced. I don't know what that is. BirthMark does another great job of having one-on-ones. You can have a prenatal conversation, a conversation with a lactation consultant prenatally to discuss the options of breastfeeding. That's a super great idea. If you think that you are pregnant or you want to become pregnant in the near future and you're like, I think I want to breastfeed, let's have that conversation now. Let's start talking about what that looks like for you and your family. But because I am like pro feed the baby. I love breastfeeding, I promise, but I want to know everything about your family dynamics so that we can make sure it's a good fit for you. When we talked about those barriers, that's some of the barriers. Like, it's not, everybody can't do it, unfortunately, for long periods of time. Everybody can do it. You can start out at the beginning, 3 days. Okay, give me 3 days. Let's breastfeed.
So let's talk about encouraging mothers that breastfeeding can go beyond 12 months. So we know what the data says. In Louisiana, we're hitting about 70% for initiation rates. But when it comes to breastfeeding to 6 months and to 12 months, we drop drastically. So let's talk about it. Do we promote breastfeeding beyond 12 months? I see everybody nodding.
Okay, I'm sorry, I know I just said something, but my ideal is I promote it. I tell you what I did, right? And people are like, oh, you breastfed for 28 months. Whoa, you got a 2-year-old and you're still breastfeeding. But I tell parents, don't worry about 12 months, 6 months, let's one day at a time, right? 1 week at a time, 1 month at a time. Like, holler at me every 3 weeks. Let's talk. Because at each stage, like Meshawn said, we have a different milestone. We have a different, even your milk changes at each stage of development. So that's just my little.
Yeah, I want to piggyback on that, because I think just educating the moms on how the milk actually changes. I don't think moms really realize the actual fat content actually changes as baby grows, and it grows with baby. It's really amazing. And so really educating the families as well, the dads and the grandmothers, a lot of moms go to their moms for help. So educating them on what that looks like. We can go beyond that. I always give my parents the textbook answer of the CDC and World Health Organization. They recommend you breastfeed your baby well beyond the age of 2. And so kind of putting that in their mind of, this is what's really recommended. This is normal. This is what we do in other countries. We're just kind of behind. So let's get on board. And you can do this. Having that support system throughout the journey is very imperative so that parents don't give up on that week or that second week or that 6-month period. They really need that support to continue to go on. So I really wanted to piggyback on that one.
I just wanted to say, like, Tay, I'm glad you said that, because like the longer you go, I think one of the biggest things for me is the health that you're taking, the more health you're taking care of yourself, right? So if I'm breastfeeding, this is what I'm passing off to my baby. I'm probably going to have a less, not as many drinks, or will not drink, right? Because you have to pump and dump and these different things, right? So I probably won't have a drink. I'm probably going to eat a little bit better because I'm passing that along to my baby. Like, this is good, not just for the baby, but it's also good for the moms. And I think making people understand that, like, look, this makes you a little bit more cognizant of taking care of yourself, and you got to take care of yourself in order to be here for your baby. I think is a strong point to make people understand, like, the longer you do this, the better.
Thank you. Okay, I have to touch on it because you said it, Chantell. This pump and dump. Can somebody tell us about, because we live in New Orleans. I can't say we, I have to take myself out. Y'all like to drink and party and all of that kind of stuff. So tell us about the pump and dump. What is this? Like, what's the truth or I don't know. Tell us.
There is new
Listen,
research.
go ahead. No, Victoria, you go.
All right, I'm not even, well, y'all take it then.
I think they're going to yield to you, Victoria.
I mean, no, well, what I advise is that if you feel, completely intoxicated, but you can't hold your head up, so that means that you can't hold your baby up.
Dr. Morse, I
hear this. I feel for her. I have a 2-year-old banging on the door, Victoria. She's like banging. No, like what I'm sure she was about to finish. I advise if you feel intoxicated, that milk cannot be given. You got to pump it and you got to throw it away. Listen, everyone, if maybe not you, Meshawn, but everyone in New Orleans, we got a little party before Mardi Gras. I tell mom, if you know you're going to go out to happy hour, you're going to go meet your friends, get a really good feed in if it's time for feeding, or get a pump in if you can, get that milk pumped in, and then go out. And then it's kind of like a judgment. If you have one glass of wine, one drink, you feel fine, you would get behind, you don't feel intoxicated, then feed that milk to your baby. But yes, if you're going to have 2 or 3, then you probably need to pump and dump. And then once, that next feed happens, you can feed your kid back. But if you get that good pump before you go out, then you have that in case these things happen. That's the big thing. But I will defer to, the lactation certified people.
No, I think we have an agreement there. So just because I do think it's a lifestyle. So we are in New Orleans and it is a part of the culture of some to drink. And so knowing that you don't have to change that, we know that breastfeeding and being a parent, there are lifestyle adjustments that you have to make, but you still can have some of the fun that you once had prior to having a baby.
And I will say, I do not get rid of any type of milk. That's why I said we don't dump. We can put it in a bag. You can put it in soap. You can put it in a bathtub. You can put it in something else. Like breast milk is very medicinal. Use it for other things.
I would use it for put it on my nipples. So just to prevent nipple drying out, like use that milk for those kind of things. I totally echo what Victoria says.
So I think the disclaimer is if you want to breastfeed, there is a way that you can breastfeed. Just talk to your specialist, your breastfeeding specialist, your lactation counselor, your physician, and find out what you need to do to maintain your lifestyle or just what adjustments. So I would like to move to another, before that I have one question. I want to move to another poll so that we can get the audience's response. So in talking about being community support, how does community support serve as an anchor for breastfeeding mothers? If Dr. Morse, you want to start us off with that one?
I think community support is the most important. I think, as a healthcare provider, as a physician that sees clients, I'm a huge advocate that I know all my partners don't, and I know physicians in the city don't, but we really should be talking about method of feeding at every visit. But I can't go home with those patients. I can't go home with the patients, and I can't always be on call 24/7 to answer the calls. And that's where the community support is so important, because they're going to have the extra resources, like Victoria said, to do the time to do a prenatal visit just to talk about breastfeeding, where I may not be able to do that as a physician. Or you're going to have a hotline number for parents to call, days, nights, weekends in the city to talk about breastfeeding. where you're going to have the baby cafe that's, you know, there from 5 to 7 p.m., which I would try to make every now and again, but, you know, you're going to have those people there to help with that. And I think that is the most important thing.
Thank you for that. So let's go to our next poll. So again, you're gonna have a cue that's gonna pop up in the chat, and it's going to last about 30 seconds. And while we wait for this, I want to just give a shout out for Victoria. So she's a living example that we are working women and we still breastfeed, and we do it past 1 year. So shout out to Victoria for breastfeeding on camera, off camera, wherever she wants. And
no shame in my game all day.
And we support you.
Thank you. I appreciate it.
All right. So poll question number 2. What supports most influence a mother's ability to breastfeed her baby? So overwhelmingly, you all said the family at 54%. Thank you. Thank you, family, for supporting moms and babies. So moving on. So how can we engage more community partners to learn more about breastfeeding and be more supportive in various settings? So that various is key. What are the other people, partners that can support breastfeeding? I see you, Tay, ready.
Go Tay.
Yes, partners like Training Grounds and the We Play Center. We really advocate to help moms increase those breastfeeding rates. We ask them when they come in the center, how are they feeling? Are they having any struggles or issues? And if we can't help them, we definitely know someone who can. I always tell them, I will not let you leave here without getting help. So making sure that we as community partners just know the other partners that can help us if we can't help them, if that makes sense. Making sure we keep those connections going, to know that, oh, I can call Chantell. I know she has this support system there. I'm going to get this mom some support so that they can have the best success possible. So making sure that we are all on the same page. We're not competitors. We're all on the same team, working for that maternal child health outcomes in our community. So making sure that we work together and keeping the same focus. And also even promoting like the posters in our buildings, making sure that it looks friendly, having us place for moms to feel safe to breastfeed in an area where they may not want to be seen, or making sure they know that you can breastfeed anywhere here, making them feel comfortable in the environment. So I think that's one of the places that we can definitely be a support to the parents.
You said one thing, Tay, that I'd like to make sure that I highlight is that none of us are competitors, and we're all working together to do this thing, to solve it. I love the fact that Dr. Morse is here. I love the fact that Victoria is here. I love Tay, like everybody that's all here, like we're all working and collaborating together, honestly, to figure this thing out. I have to give it from a city's perspective. I think there's 3,400 babies born every year in the city of New Orleans. That's a lot of mamas. And that's a lot of people that we have to give support to. So if I can't help you, then I'm gonna call Meshawn, who's gonna call Portia for me, or Portia gonna text me, and she's gonna call Dr. Morse and say, I know you on vacation, but can you answer this question for me? Like all of these things are going to happen in order for us to be able to support moms. I love the spirit of this community, of the maternal child health community, and us collaborating and doing these things a whole lot more, and understanding that we are collaborative and working together. We're gonna figure this out.
I love that. I heard once someone use that, what you're talking about, the New Orleans way. We're just gonna call, text. It doesn't matter what the 1-800 number or the 517 milk number. I'm gonna text Tay and get this information, or I am going to FaceTime Victoria so she can see what this is. Thank you for that. Anyone else? Go ahead.
You know, I'm out the box, right? And so I'm a social worker by training, and those are also the people who we need to get on board with breastfeeding and in a collaborative method. So we're looking at psychologists, psychiatrists, people who deal with maternal child health, perinatal mental health people, because a lot of breastfeeding is brain and breast. Most of breastfeeding is about the brain. So we can, calm your anxiety a little bit around breastfeeding. If we can have conversations about stress, we can have conversations about real rest, R-E-S-T, like real rest. We can increase breastfeeding rates just a little bit longer, like duration of breastfeeding rates. Because after 3 or 4 days of that week or that 2 weeks or that 3 weeks, after it gets really, really hard, people fall off because stress, because your brain is tricking you into believing that you can't do it, or you've gotten, oh, my baby got a tongue tie, or all these different things that, the medical industry throw at you. Oh, weight gain and weight loss and all those things. So let's bring in chiropractors and, massage therapists and all those people to help with the duration of breastfeeding and initiation too, as well. So.
I love that, brain and breast. And I was about to pass it to you, Dr. Morse, so perfect.
I was just saying, I love what Victoria said, like brain and breast is so important. And I think the thing that kills me as a healthcare provider, but I know was stress for me, and I know it's stress for my patients, across all backgrounds, is going back to work, right? Like we may do really good for the first 3 to 4 weeks, and then we're going back to work, and that becomes an issue.
Yeah, it's really key. So Victoria brought up something, Tay, that I would love for you to touch on. She said that she is a social worker. One of the collaborations that happened was We Play Center as a childhood center and the NOLA Baby Cafe. And what could you talk about that marriage and how the emotional benefits that happened as a result of that?
Yes. So back in, I think that was 2019, we made that verge. When I first joined in with Training Grounds Baby Cafe, and Training Grounds was able to meet together, and we would host baby cafe sessions here in the center, and kind of having the parent educators on board, talking about development, and then having those lactation counselors here, and us being able to tag team was like a dynamic duo. It was an awesome, amazing experience. Moms really loved to come here. They felt safe because their babies got to play. They learned some other things about development, and they were also learned how to latch their baby, how to preserve that milk. And so it was just a really amazing thing to be able to connect. So having those community partners connect is so valuable, so that we can continue to help our moms and dads and grandmothers on this breastfeeding journey.
Thank you for that.
Yes.
So let's talk about equity a little more, or right now. Why is talking about breastfeeding important in New Orleans? Chantell, can you talk about that?
Absolutely. I think the more we talk about it, the more, like Tara said, Dr. Morse said, it's not sexualized. The stigmas start to come down. And it's a common thing. Like, we have to make this a part of our normal conversations. Like, we can't make this like, oh, wow, you're breastfeeding. No, this has to be the norm. We have to set the tone for this, for us understanding that this is the foundation of us as a city being able to support babies, right, who are going to eventually grow into good citizens for the city, right? So as we support them with better brain development and, increasing, nutritional support and all these other different things, like, this impacts us as a greater part of the community. So what better way to start than the very foundation of breastfeeding? This has long-term impacts that we all know, right? But we have to make this as a part of the messaging that if we don't do this, right? If we are not doing this, and I'm going to bring it there, and I'm probably cringing at the thought of even bringing it here, right? We're talking about vaccinations. We're talking about, we don't know what is in vaccinations. We don't know what's in them. You know what's in breast milk because you know what you put in your body. So if we don't set these foundational things and we don't tie them into the larger picture of our community, right? It seems like a very small thing, but it's actually not. It is a huge thing in order to be able to move the needles in so many other different places. And the more we normalize this and the more that we talk about it and bring it up, like, you didn't breastfeed? Really? Why not? You know, like we have to be able to do that in order for us to not make this like, oh, it's some special thing. It is what you should be doing. It is, honestly, is, I'll say as the city person here, it's your civic responsibility, right? In order to be able to do this. We just have to change the narrative, and we have control over the narrative that we build, and it starts with us.
Yeah, I know Victoria's gonna pipe in, but so you brought up a very good point, Chantell, because sometimes people say, oh, it's breastfeeding, it's an option to do it. Yes, but I just have a little issue with that. So Victoria, I'm pretty sure you were about to say something about that.
No, I was about to say, New Orleans is hurricane capital of the world, right? We had this conversation earlier. Breastfeeding is important for emergency preparedness. Like breastfeeding is like important all around, like your entire way of life changes when you breastfeed. As a parent, I can count on one hand how many times I've been sick. You know, my immune system is built, my baby's immune system is building. So it's important, not just because of, our region, of course, because of our region is definitely important. But it's not just important because of that, it's also important because of the health reasons and all of the other benefits you receive just from starting, initiating breastfeeding.
Yeah. So you just grazed the topic of that. You said it builds your immune system. I don't know if many people understand, you're talking about from a mother's perspective. So talk about that, building mother and baby immune system, how that works. Give us your
Chantell touched on that as like we have to, digest great foods and, lower our stress, and all those things help increase our milk. And I'm probably gonna get interrupted because I'm breastfeeding right now.
That's okay, Taeshaun can pick up.
But as a parent, and the saliva of your baby and the composition of your milk and all of that, is created especially for your baby. That builds your immune system. That not only provides benefit to you, but also to you. It's just like an overall. And the less I'm sick, the less my husband's sick. It's like a whole family dynamic in that. That breastfeeding just doesn't just support you; it supports the family.
Right. Tay, you can go ahead.
Yes, I was just feedback on what she was saying about the baby saliva sending that signal to mom's breast to change that milk, or even like during COVID, if moms have COVID, you can still breastfeed your baby, and you're going to give your babies the antibodies, which is absolutely amazing. It's astonishing. So just thinking about all those different protective factors that you can do, and we want to make sure we're supplementing at the breast. I know a lot of people say just feed the baby. Yes, we want to feed the baby, but we can still feed the baby breast milk. We can supplement at the breast with different things, spoon, syringe feeding, cup feedings, finger feeding, milk banks, and always remembering that there's a very low percentage of women who cannot medically breastfeed. There's only about 2 to 3% of women who cannot medically breastfeed. All others just need help with latch and milk preservation. So really think about that. And what are we really teaching our families about formula and all those other types of things? So just making sure we know what they're getting, really educating parents. I just feel like people just really don't know what we have in our bodies. I mean, we even have like stem cells. Like there could be a cure to cancer in there. And we're, it's like, it's so amazing. It's antimicrobial, and it's just so cool when you learn more about it. And so we just want to give our babies the best that we can possibly give them.
Thank you. And Dr. Morse, can you talk about it from the healthcare setting? And like, why is it important for healthcare systems to talk about breastfeeding?
Well, I think it's important for healthcare systems. We need to get our healthcare systems to have buy-in, to have better lactation support in hospitals, a better immediate lactation support. I think, my hated thing as a physician, and I hate to be so strong about that, but it is true, is like when I ask mom, what are you going to do? Breast, formula, and the answer is both. And then there's the both. And then I walk into a room and mom is like, well, I gave the baby the breast, but then I gave the baby 2 ounces of formula that's in a bottle. And I'm like, throw it away. Like, we need to get our healthcare partners, all the hospitals involved. That means educating all the nurses, that making sure we have extra lactation support. That means getting our insurance plans on board too. My frustration as a physician is I want, a mom wants to be, she goes to Victoria, she goes to Tay, she goes to Chantell's, community things and says, hey, I want to be a breastfeeding mom, but I know I have to go back to work. I know I'm gonna have to start pumping. And some of our insurance plans in the city won't even allow moms to get breast pumps before the baby's born, right? Like, why can't I get my mom her pump before the baby's even born if she knows this is going to be a stressor for her that we can try to alleviate early on and educate her, hey, we maybe don't want you to use your pump in the beginning, but it's there if you need it, and it's there. You can go to a specialist before the baby's even born and learn how to use it. It's so frustrating, but we really need to get that full dynamic. And I think it echoes to what Chantell was saying, is we need to change the narrative. We really do. As a collective group, we need to change the narrative.
Yeah. Someone put in the chat, Chantell, can you talk about from an employer perspective? Someone talked about how the workplaces need to support breastfeeding. Can you talk about that when moms are returning to work?
Yeah, so a part of some of the initiatives have been, and it started at City Hall, so we've made these safe places, right, for people to go and be able to pump. And honestly, it's just a matter of privacy. Your child is not there at that particular time and what have you. So, the perception, right? We're sexualizing this thing. I am actually in a process of, pumping, right, to feed my child. However, the perception of sexualization, throughout our culture is that, oh, you need to go somewhere into this space. So one, we have to first remove that issue, right? That's the first thing. The second thing is, as employers, just like, and I'll say the health department is working towards sick leave. We also have to make sure that we continue, because it started and I think it kind of fell off, but we have to continue to say, like, listen, we have to allow employees the time and the space in order to be able to pump. Then beyond that is the storage, right? So making sure that there's a place for people to be able to do that. I think those are city policy initiatives that, we can support on, but of course we have to bring it to a larger scale. New Orleans is one small microcosm of this, but how many of us actually live in New Orleans, right? How many of us actually live in the city? We have to look at policy-based stuff from a state, regional perspective. And the more we have these conversations, as I said, and say, you know what, let me put this on my radar, because this will make this a part of our policy initiative, right? We are working currently on our community health improvement plan for the city's health department. One of the things that we wrote in was, do we still need to address, and I'm saying this, remember, not everybody in the room is very maternal child health centric, but we say, do we still need to put a focus on breastfeeding, right? To 6 months. I will say the women in the room, and remember how your health department is led, is myself, Dr. Avegno, and then we have a policy, person that's been brought on. But we said, for us, right? Remember, for us, oh, this is not an issue, because everybody knows about breastfeeding and we realize it. And then we go on and we say, nope, but working women, right, are having issues with continuing, because then they fall off and then it's cumbersome and it's a whole other different thing. We have to frame our work in community for how we want policy to be driven. And we can support I'll say from the city's perspective on how we drive policy in supporting these initiatives and efforts. So that is getting us to write policy and then getting employers to be on board with, hey, what does this look like for you and your staff members? So I know that was a very long way to think about it, but I always think encompassing of like what we have the ability in order to be able to impact. So look, I have my notes that I'm writing down and I have these things. So when we have our policy discussions, we need to consider this, because it has to be more widespread and available, and it has to make sense for employers. I wish that I could just say that, it's an employee type perspective, but we have to figure out how it makes sense for employers so that they're more open and receptive in order to be able to allow women to do it. So it's a policy thing for me. So anybody here from the city, just know it's going to be on the next thing that we talk about.
Yes, I want to piggyback on that, Chantell, really quickly. It would be really quick about like expanding Medicaid. Because a lot of our mothers of color have Medicaid, and so they don't have those benefits of getting breastfeeding education and lactation counselors and access to those pumps like Dr. Morse was speaking about before. So it totally just encompasses all of that.
Mm-hmm. Absolutely.
So Chantell, you brought up policies. There are working on policies, but there are policies that are in effect right now that people may not know about. Victoria, I know you were on I know I'm not going to throw you out there too bad. You were on the Mama Plus Health Policy work group. Can you talk about and prior to that, just some of the policies that support breastfeeding and pregnant workers?
Yes, I am on the Mama Plus working group, and we are excited that some of the things that we started off with an idea around, we wanted to support other community organizations who were in policy work. And so it was way more in depth than that. And so we were able to make some moves and get some resolutions around social determinants of health and things that affect birthing people here in New Orleans and really across the state of Louisiana. We have a couple of working concepts around employers understanding how important it is for mothers to be able to breastfeed, or birthing people to be able to breastfeed openly and in their spaces. I don't know what was, of course, the result of that was a resolution, probably, or something that people are able to use as a reference when you're talking to your employers about their having access to breastfeed in their facility.
Yeah, people should go online. Governor Bell Edwards signed the Pregnant Workers Fairness Act, so it protects people in the workplace. So I think it's time for another poll. Are y'all ready for another poll? All right, so get ready for your next poll. All right, you probably have a few more seconds. All right, poll question number 3. How do we make New Orleans a breastfeeding-friendly city? And it looks like it was a close one, but 39% of you said better workplace policies and on-site access, with a close second at 32%, more education about the benefits of breastfeeding. So panelists, let's talk about this. As you know, I Am New Orleans, the conversations are centered on discussing issues of equity. So how can we create more resources and support for breastfeeding for moms in BIPOC communities? All right, long pause, but you want to start us off, Tate?
Sure. So I think if the hospitals are a really great place to start, because that's when that first time comes, really educating them on what the magical hour of birth looks like, putting baby skin to skin, and trying to put baby to breast, or getting breast milk at least an hour after birth is really crucial and imperative, and really educating them. And also research has shown that most hospitals, they tend to give those formula samples more to African-American families. And so really trying to kind of bring that whole dynamic down. making sure we're really educating moms on what they have in themselves to be able to properly breastfeed their babies. So really encouraging that, I think, in the hospitals can be very beneficial. Like with that poll question, it's kind of hard to really dig deep to see which one is best. I think all of them have a very valid spot. So it was kind of hard to really say what it really matters. But for me, I go back to the hospital, and then also even before then, that education before then really helps moms kind of just prepare their mind for what they're really going through, and not hearing like, that's what you're gonna do, or getting those weird faces. And it kind of it makes you second guess yourself, or not be sure what you can really do, when really I was born and created to birth and feed my baby. And just kind of bring coming back to those simplistic things, I think would be very beneficial.
So Dr. Morse, can you talk more, early, Tate touched on it, but talking about supplements or formula giveaways at the hospital, can you talk more about your stance on that?
Yeah, I mean, I don't support it. I know the facility I work at has pulled away from that. But I do think what Tay and all of us as panelists have touched on, there is some degree of implicit bias. I mean, we all have to recognize that there is some degree of implicit bias that still is very deep within the healthcare system. And so it's making sure to be an advocate against that, to, treat all moms regardless the same, and really make sure to protect that golden hour, make sure to put the baby to the mom's skin, make sure to always have the same conversation back and forth. And it's also just make sure that those samples aren't given, they aren't given to one, ethnic group over another. And that as a hospital, we shouldn't really promote that. We really should promote that your body is the best, because in medicine, we should be saying, hey, there are all these health benefits to breastfeeding. And so if we're really going to do full body, mind, spirit, soul, health care, we should be saying, this is what your body was created to do. As Tay said, this is what we were born to do, and this is what we should do. And these are the benefits of doing it.
Another way that we can be, is to support the lactation consultants. So making sure that we are able to get compensation, and Medicaid can pay for IBCLC visits and lactation consulting. So if you support those who are supporting those who need the service, that shows the city that we are investing in professionals to help you, right? We invest in doctors, we invest in all these different other medical fields. Let's invest in those who can really, we change the trajectory of people's lives. As a doula and me supporting a person during their birth, I'm changing generational birth experience. Come on, y'all. We gotta get into the fact that this is not just one instance in life. Just in the same way that people have C-sections. I only have one visit after my C-section. When I have my mom had hip surgery. She had a home health nurse. She went to rehab. I had a C-section and only got one visit. Come on. We have to change the literally, as Sister Midwife say, change the paradigm. We have to change the idea of this whole birthing situation. That's how we become breastfeeding friendly. We invest in those who are supporting the people who need to be supported. So invest in your doulas, invest in your community health workers. I train perinatal community health workers who are not just doulas. They do the entire thing. They're little little community health workers and doulas and childbirth educators. So we have the people, I'm training people, but at some point I'm gonna have to be oh, well, I'm not gonna be able to pay you. I guess you gotta figure it out and have your own business. No, I want to put them somewhere. I want community health workers in hospitals, at WIC clinics, on the streets, wherever people are who need support. So let's start thinking outside the box.
Love it. Preach it. I agree with you, Victoria. I'm just going to echo real fast. Why do we not support the 4th trimester? I hate it as a physician. Why was I allowed one postpartum visit? Maybe 2 if I could code it right. Why are we not supporting the full 4th trimester, the full 12 weeks post that birth, where so many things change? It's beyond me. We need to change that.
If I could jump in real quick, that's about to change. And in my time just here in the city, we have been working very, very diligently on the 4th trimester. It is becoming a doula, understanding what that's supposed to look like. That is changing what Healthy Start looks like. This is right now, we're currently working on universal home visits. We're working on so many different things because the 4th trimester is so important. I can say personally that had I had the support that I needed during the 4th trimester, then my baby would have been fed, breastfed, and what so many other different things would have happened, or my babies would have been breastfed. That 4th trimester, you hit it, like that's it. And I realized the importance of it. And again, it's framing for how we do community building. So that's the movement, that if you take away nothing from here, is understanding that support. Everybody here on this call, everybody who's speaking on this call supports in the 4th trimester. We have to recognize it as such. And we're working, I promise, to change policy on how we impact the 4th trimester, because that impacts our infant and maternal morbidity rates here in our state, in our city, right? So we have to be able to address those in that particular, in that trimester. So yeah, that's it.
I love it. There was a question that came out of the chat that Dr. Morse, I would love for you to touch on. And the question talked about low breast tissue, and how it affects the milk supply. Can you talk about that?
Yeah, and I mean, of course, everyone trying to, but it doesn't. Why? Are we saying smaller breasts make less milk? Like, that's just weird. Bigger breasts make more milk? I mean, in reality, no. I think it's just a myth too that people have kind of promoted that. I think it's preserving the breast, it's preserving your milk, and it's preserving what you are going to create. And I think the thing is, when women do get into breastfeeding, they start to compare, right? I think naturally we just compare. And so it's like, well, you pumped 4 ounces, you pumped 2 ounces. It's what your baby needs, not necessarily what you're doing in comparison to someone else, not what your breasts look like in comparison to someone else. And I think that's a really important thing to talk about. And I echo the other panelists to chime in their opinion on that as well. But I see that a lot. It's just moms will be like, I only got 2.5 ounces today. Well, that's okay. It's okay if your friend's getting 4. Your baby maybe only needs 2.5 ounces. And I saw someone just pop something about birth control effects in the breast milk. Honestly, in reality, no, we don't really see that anymore. So we still promote you to breastfeed. It's just hydration, it's nutrition, it's all of those things that are the most important things for your breast milk.
Yeah, thank you, Dr. Morse. I say that all the time. It's not about the size of your breast, right? It's definitely, I tell my parents, please get off social media when you breastfeed. Don't tell me about, you remember the stash was a fad, like people always showing their stash. Come on, no, we're not doing that. We are not showing stash. I need you to get off Facebook, get off Instagram, get in those support groups. And sometimes the support groups can be a little, people doing a lot. So having, a lactation consultant on call that can provide, unbiased information. Yes, that's the best way for us to continue to have complete duration of breastfeeding. I'm breastfeeding now.
Yeah, I think too, with moms using formula or seeing the bottle feeding, they see all this milk poured into this bottle and they assume that our baby needs all of this milk. And so getting over that, really just kind of educating them on what breastfeeding really looks like. So yes, Dr. Morse, you put the head on the nail.
Well, I think you hit it. It's right. It's like you see all this milk coming in a formula bottle and you can't quantify what's coming out of your breast. Now we tell people your baby will be satisfied. When your baby's satisfied, you're done, That's it. And I think that's hard for people to understand.
We kind of talked about it earlier. Can you all talk about, we are in the middle of hurricane season and talking about breastfeeding versus formula feeding and stashing all of that breast milk during this time?
Well, I think I'll quickly just say, obviously, and Victoria touched on it, like hurricane season, emergency preparedness, you can just bring your boobs with you. And so you don't need all the formula, right? You don't have to take those fancy formula machines or the big pouches or whatever. women do have their stash and they freak out about it. I mean, you don't really need it either. We don't want you to lose it. I was definitely a mom who had a stash, and Portia knows that going back to work, but but you don't need it. Like, you're still not going to need it. And so, sure, protect it in a cooler if you need to, that kind of thing if you want, but you have what's on your body. It's there with you.
And we also recognize that there are people who are formula feeding. So liquid formula is recommended over powder all day, any day. So, but breast is also accessible. It's on your body. You take it with you. It can get rained on. It can get, literally, I have seen moms breastfeed in all types of stressful situations, and we still produce milk because our babies provide oxytocin. They provide that love. They provide that what we need in order to produce. Anyway, I'm getting too deep, but brain and breast. Okay, remember that.
That's our new mantra, brain and breast. So before we close out, I really would love to have final thoughts from each of you. I mean, you all have dropped a lot of jewels today. I love the value added with this particular group of women. So if you all can just close us out with some final thoughts, and no big rush, just final thoughts. Go ahead, Tay.
Go first. So I just want to say to all those mommies listening, or women who are preparing to be moms or thinking about it, just know that your body is magical. You have everything within you to soothe and calm your baby, to feed your baby, and that we are here to help. If we know you have all these different community partners that you can reach out to, don't go alone in this journey. Know that you have somebody there. And I'm so happy that I was able to be here today.
Thank you. Dr. Morse.
First off, thanks to all the panelists and all the moms that are listening. I think, echoing what Tay said too, you're not alone. We've all done it. We've all come from different walks of life. We've all have different feeding journeys for our kids. We all recognize that we are all breast is best kind of people, but obviously for some people it doesn't work out. But it's finding the feeding goal that really works for you. And if we can change the narrative in the city, we can know that we can change some of those stereotypes. We can break down some of those barriers for moms to really realize that they should be able to ask their healthcare providers. They should be able to ask for community outreach programs that can assist them, that they should be able to ask their employers for breastfeeding time. I want to see breastfeeding pods on the Mardi Gras route for 2023. That would be awesome. But to know that we can change the narrative going forward for our generations, for our kids. Like, I don't want my daughter to feel shunned for breastfeeding and wanting to breastfeed. I love that my son watches me breastfeed my daughter and he is still all about it. I want that for the other women of New Orleans, because I think if we start changing that narrative, we're going to change generations and how families function, how dads interact in the family, how people stay put, how we get grandmas involved, and that's only going to promote us to have a healthier city in the long run.
So Chantell is going to be on those pods for Mardi Gras, right, Chantell?
Listen, you already know that's my thing. So I'll absolutely be on there. I have had to figure out, as a float lieutenant previously in my life, like I've had to figure out like what that actually looked like, right? For a mom that says, I need to pump, I got to feed right before we get on the float, and I got to make it happen. So I've done that, and I know that it's possible. In closing, I just like to say one of the things that Tara kind of mentioned, we put this thing like, oh, it's Black women, that it's every woman, right? Because Tara had the same messaging that I had, and we weren't in the same household, right? It is everyone. It is making sure that we make sure that the message touches everyone. And the more we make this about women and not necessarily, oh, it's just Black women and what have you, then, I mean, like, I want equitability, right? I don't want Tara to receive something that I am supposed to have, or, well, why is it just Black women that have to breastfeed? No, all women have to breastfeed. And we have to make sure that that is a consistent thing, so that the perception, whether it is us directly or it's our family members who support us, because that's a bigger part of the conversation, they have to be hearing the messaging and understanding that, you know what, this is important not only for mom, baby, dad, family, and for the community. And we have to make sure that that is the message that resonates throughout. In order for us to be a healthy city, we do have to be a breastfeeding city. And in order for us to move the needle forward in any of the things that we want to be able to do, we got to start with those who we cherish the most, and that's our babies. So let's give them the best.
Thank you.
Yes, I echo everyone. We're all on the same wavelength. Something that I also think about in closing to all our birthing people who are thinking about breastfeeding, have those conversations among your peers. Like, don't just wait on us. Don't just wait on lactation consultants to have the conversation. You can host a Facebook Live. You can pull in some professionals to have the conversation among your own community, right? This is the same thing that we do when we're talking about racial equity, culturally competency. Is not just a conversation for me and and the people who I think need to hear it. It's also a conversation for me and my peers and the people who are along my line when we think about our friendship line. And so also, breastfeeding should be a mutually exclusive relationship. It's a relationship. So like, you should get, as a birthing person, should get as much out of it as the baby does. I mean, relaxation and the benefits are there. We just have to get into it, like brain and breast. Your brain can allow you to believe that you can't do it, but there are generations of people who have been breastfeeding, all races, all colors, all people. We breastfeed. Like, that's what our body was literally created to do. And it's so magical. And when I think about it, I get chills. As Tara said, like, I watch my children play with their dolls and like, they don't know about a bottle. And it's not to shame anyone. It's just to understand that, like, we were created for this. My little girls right here have my grandchildren, and inside of them, they are being breastfed. I mean, period. Like, so sorry. I love this work and I love you all. And I'm here to support you. Whatever goals that you may have, I'm here. We all are here, obviously.
And we all are. Thank you all. As you all saw, we have some passionate people here on our panel today, but they are only a representation of your MCH community that are out there day and day doing the work on your behalf, because we love you so much. So I want to thank you, our wonderful audience, for coming in, and for everyone in the MCH community. I want to thank the W.K. Kellogg Foundation for your work in supporting us. This event is just valuable, and I'm very, my heart is warm because I love working with this group of women. And so thank you for the participants for all of your information that you put in the site, in the chat box. And of course, we want to hear your breastfeeding stories. So please go on social media using the hashtag #IamNewOrleans and visit the website for I Am New Orleans. Every Child Thrives. And we love you and thank you for coming out.